The respiratory system, structure, function, conditions, and treatments. The respiratory system is essential for sustaining life by facilitating the exchange of gases between the body and the environment. It ensures that oxygen enters the bloodstream and carbon dioxide, a waste product of metabolism, is expelled. This process supports cellular respiration, energy production, and overall body function. Structure of the respiratory system. The respiratory system is divided into two main parts: the upper and lower respiratory tracts. Upper respiratory tract, nose and nasal cavity filters, warms and moistens incoming air. Pharynx, throat, serves as a passageway for both air and food. Larynx, voice box, contains the vocal cords and prevents food from entering the trachea. Lower respiratory tract, trachea, windpipe, a tube that connects the larynx to the bronchi, lined with cilia to trap particles. Bronchi and bronchioles, branching airways that distribute air throughout the lungs. Lungs, the main organs of respiration, containing alveoli where gas exchange occurs. Alveoli, tiny air sacs surrounded by capillaries where oxygen enters the blood and carbon dioxide leaves. Diaphragm, a dome-shaped muscle that contracts and relaxes to control breathing movements. Function of the respiratory system. Gas exchange, oxygen is absorbed into the bloodstream, and carbon dioxide is expelled. Regulation of blood pH maintains acid-base balance by controlling carbon dioxide levels. Voice production, air passing through the larynx produces sound. Olfaction, smell, airborne molecules stimulate receptors in the nasal cavity. Protection, mucus and cilia trap dust, pathogens, and pollutants to prevent infection. Mechanism of breathing. Inhalation, inspiration, the diaphragm contracts and moves downward, expanding the chest cavity and drawing air into the lungs. Exhalation, expiration, the diaphragm relaxes, reducing chest volume and pushing air out of the lungs. Common respiratory conditions and diseases. 1. Asthma. Description: a chronic condition where airways become inflamed and narrow, causing difficulty in breathing. Symptoms: wheezing, coughing, chest tightness, shortness of breath. Treatment: inhaled corticosteroids, bronchodilators, avoiding triggers, and long-term management plans. 2. Chronic obstructive pulmonary disease, COPD. Description: a group of diseases, including chronic bronchitis and emphysema, that cause airflow blockage. Symptoms: persistent cough, mucus production, fatigue, and breathlessness. Treatment: smoking cessation, bronchodilators, oxygen therapy, pulmonary rehabilitation. 3. Pneumonia. Description: infection that inflames the air sacs in one or both lungs, which may fill with fluid. Symptoms: fever, chills, cough with phlegm. Chest pain, difficulty breathing. Treatment: antibiotics for bacterial pneumonia, antivirals for viral pneumonia, rest and fluids. 4. Tuberculosis, TB. Description: a bacterial infection caused by Mycobacterium tuberculosis that primarily affects the lungs. Symptoms: persistent cough, weight loss, night sweats, fever. Treatment: long-term antibiotic therapy, usually 6-9 months. 5. Lung cancer. Description: uncontrolled growth of abnormal cells in the lungs. Symptoms: chronic cough, chest pain, coughing up blood, unexplained weight loss. Treatment: surgery, chemotherapy, radiation therapy, targeted drug therapy, immunotherapy. 6. Pulmonary fibrosis. Description: scarring of lung tissue leading to stiffness and reduced oxygen transfer. Symptoms: shortness of breath, dry cough, fatigue. Treatment: medications to slow progression, oxygen therapy, lung transplant in severe cases. 7. Sleep apnea. Description: a disorder where breathing repeatedly stops and starts during sleep. Symptoms: loud snoring, daytime fatigue, morning headaches. Treatment: continuous positive airway pressure, CPAP therapy. Weight management, surgery in severe cases. Diagnostic methods: chest X-ray detects infections, tumors, or fluid buildup. Spirometry measures lung capacity and airflow. CT scan provides detailed images of lung structures. Arterial blood gas test measures oxygen and carbon dioxide levels in the blood. Bronchoscopy allows direct visualization of airways using a flexible tube. Preventive measures: avoid smoking and exposure to pollutants. Maintain good hygiene to prevent infections. Get vaccinated against influenza and pneumonia. Exercise regularly to strengthen respiratory muscles. Maintain a balanced diet to support immune function. The respiratory system is vital for maintaining life by ensuring efficient gas exchange and supporting cellular function. Understanding its structure, functions, and common diseases allows for better prevention, early detection, and effective treatment of respiratory conditions. Proper care and lifestyle choices can significantly enhance respiratory health and overall well being.